let me give you a little background of internship. Sit down, study USMLE 2. You are fresh with all the clinical sciences that are needed in step 2, and you are preparing for step 2. A dedicated preparation is needed, at least 6 to 8 hours per day. And that you can do while doing internship. You can slog in so many hours and do that. So 4 months, give step 2 exam. Within the first 6 months of your internship, you're done with step 1, you're done with step 2, and then now you have an option to extend your internship. You need not finish at the dedicated time. Tell them that I want to finish my internship, I'm going to take a break for 6 months or 3 months, and then finish my internship 3 months later. Why? Because during this time you're still a medical student and you can come for electives. There are a couple of types of United States clinical experiences. One is and these are called as clinical rotations in US. One is observership, wherein you don't get to do anything. You just are with a physician on their rounds. You just observe, look and observe. You're not able to do anything, right? And that's a last resort. If you and that is usually for people who have finished their internship, who are doing post graduation, and they are on the journey for USMLE. That is reserved for them. For people who have not graduated, you are eligible to do electives. Electives are number one in the experience. Why? Because you are able to talk to the patients. You will be assigned patients to take care of them. So you talk to the patient, take their history and physical, do the examination, see the labs on them, and then form an assessment and plan and present to the attending physician while on round. So it's an active involvement, and that is why they are valued more. These are called as electives. And that is why I'm suggesting to you postpone your internship so that during that time you can come to US and do your 2 or 3 clinical rotations. So by the time you finish your internship or graduate, you have finished step 1, you have finished step 2, and you have finished 2 to 3 electives. And that's a complete spectrum that is needed by program directors, by selection committees that we see in a candidate, right? And that also tells us your dedication, your motivation, your grit and resolve to achieve what you want to achieve in a timely manner. A lot of people will have 10-year program. You don't want to do that. But try to do that at the earliest and at the right time. Not that it counts against you, but it is important to that way you'll save time in your life. Um, and you will also be able to optimize and begin residency at a proper time. You don't want to. So now there's a 5-year rule. From the time you graduate, you are given 5 years, and that might get shortened further down the road. So you don't want to just keep waiting for a year, take step 1, for another year, do house job in India, and do some try out your practice, and then do step 2. In that you waste time because there is a 5-year cutoff window, which might get reduced to 3-year cutoff window. So the best time is to finish all this during internship or immediately after that. So that is about USMLE step 1 and step 2. There are products, and you can communicate with me and I'll be happy to guide you with that. You can write down my WhatsApp number and directly communicate with me. It is the area code is 1312 437 7866. You can WhatsApp me, you can introduce yourself. I'm from AMSA, you gave us a webinar, and I would like to know this. I'll be happy to help you with that. So that is as far as USMLE step 1 and step 2. And of course, there are a lot of things. There's a lot of information. I cannot tell you everything because it is it is there in maybe in question answer form we'll be able to better cover that. But that is what comes to the top of my head in terms of USMLE step 1, step 2. Um, the most important thing is you have to remember this because this is a make or break for you. Step one is pass and fail. Important. That is the number one, number two, number three. Step two score of, you should try to have as high as step two score. Um, if you score in 220s or low 230s, there is a very good probability that you will not get interviews, that you will not match. Your idea should be to score more than at least 245. And how do you do that? Again, do at least 10 to 15,000 questions. UWorld has about 2,000 questions. Emboss has a couple of thousand questions. Our products have 4 to 5,000 questions. Try to do 10 to 15,000 questions. And then you can figure out how much time you'll take. You'll take at least a good 4 to 5 months of preparation. Um, uh, so doing as many questions as possible, keeping your own notes, make notes as you are doing questions, categorize them into cardiology, pulmonology, endocrinology, so that you can revise them frequently, and just before the exams you can review them. That's very important. Otherwise all that hard work is going to go to waste. And also doing so many questions gives you the aptitude and ability to tackle the questions. It's a kind of a diffuse knowledge, right? You have the knowledge in your head, you got to apply, and that is how you will score better. So doing as many questions as possible and reviewing the information that you have collected is the key and success to scoring high in step two. Step two scores are the single most important thing for programs to take you. After that, they see what is your United States clinical experience. After that, they will see, okay, what else have you done? Research, this, that. Remember, research is an adjuvant. It is not a primary determinant for you to get into a program. If you have low scores, you can, of course, supplement it with research, try to make yourself more attractive and competitive, but it is not the primary determinant. The primary determinant is step two score, and the second primary determinant is your clinical experience in US. The clinical now, so that is about USMLE step one and step two. I'm going to go to the next topic, and then we can have a general question answer session later on. The second topic is United States clinical experience, USCE. That involves clinical rotations, which could be electives, which could be externships, which could be observerships, right? And the information is available on IntHealth and IRAS and all those websites for you to get. So also try to find out as much information as you can by going on the websites, by going trying to find what things are. But gathering clinical rotations and doing clinical rotations after you have finished step two or before you have finished step two, with us you can do clinical rotations even without step one and step two. That's not a problem. And they will be counted towards your credit. But ideally, it is best to do it after step one or step two. Then you are better equipped with a whole lot of your own knowledge of medical school. You have an idea of uh, how to manage patients and so on and so forth. So it makes a whole lot of sense to do it in your after your final year, during your final year, or during your internship year. um, the clinical rotations, a lot of people, and you will have a lot of seniors who come and do clinical rotations. uh, Sorry. It is important to do clinical rotations which are based in the hospitals, which give you exposure to the patients in the hospital, which are university hospital affiliated. They are important. That is number one. Why? Because when you are selected as a resident, you spend 95% of your time on the floors managing patients in the hospital. The clinic time is only one half day, that is 4 to 5 hours. The lot of clinical rotations in US are clinic based. These agencies will put you in clinic here, clinic there. um, Majority of the exposure is in the clinics. That is not what you want. You want a rotation that predominantly gives you a hospital exposure, or at least 2 out of 4 5 days of hospital exposure. That is very key. That is number one. Number two, good clinical rotations are ones in which you are able to talk to the patient, in which you are able to examine the patient, because that is what the programs are looking for, your exposure in the United States healthcare setup. So when you talk to black patients, their accent, their behavior, their interaction, that is what the program directors and us as selection committees see. Have you been exposed to that? Because if you have been exposed to that, you're a better asset to me in my program come July 1, right? Than somebody who has not done any of that at all. You should be able to do that. You should be able to enter into the environment of the hospital. You should be able to interact with the nurses, with the care providers, with other consultants. That's called as a United States clinical